This is the procedure video for an IM injection. And so I have already looked at the orders for this patient and identified how much that I'm going to give. I have secured the medication, and I have gotten the supplies that I need for this procedure. So I will be giving this injection IM. I do have to draw it up with one needle and replace it with a second needle. So that's what I have drawn up. So in this package is a syringe and a needle, and then I have an additional needle, okay, for my supplies. So I'm gonna lay those there, and before I start pulling up the medication, I'm gonna wash my hands. And I'm going to go ahead and open this package. Actually, this is a better way to open these packages because, as you can see, this one, everything kind of lives in a little bowl there. So it can just sort of sit there, so you could reach in and pull it out. And you're going to attach this needle. And then you're going to draw back. I'm going to give 1 milliliter of this medication, so I'm going to draw back that much air. Okay. And for my medication vial, I'm going to clean the top. And I'm going to allow that to dry naturally. And now it is dry. So I'm going to unsheath this needle, throw that away, inject the needle into the vial, and inject the air. Flip it up. Turn it around to where I can see the numbers. And if you'll see there, I've got a pretty good sized bubble because there's a little bit more air in between this needle and the syringe and the needle. So I'm just gonna push that back up, get that air out of there. And now, as you can see, that bubble is gone. Bubbles always just wanna go to the top. So if you do have a bubble that lingers in the syringe, just tap it a little bit, try to get it to go to the top, pull it down a little bit more, and a little bit up to push it out. Okay. Now I'm going to put the safety on this needle. Now I could, if I wanted to, lay this down to get the other needle, or I can hold it in my hand. Either way, the end is covered. So I'm just going to lay it down while I open up this package. Peel it back like a banana. Now I'm just going to kind of use my pinky, or you can use your other hand entirely. Just make sure you don't touch those sterile ends as they come together. Okay, and this goes into the sharps. And then one other thing about some of the safeties is you want to make sure you pull that down before you actually unsheath the needle. Okay, so now it's ready to give. I'm going to go to my patient who I have identified and asked allergies, and I've told them about the medication. So I'm going to wash my hands. Apply my gloves. And I have identified where I'm going to give the medication, so I'm going to go ahead and clean that site. And again, allowing that to dry on its own. And we're going to say that it's dry. Remember, no blowing or waving over the top. Then I'm going to unsheath the needle. I'm going to hold Z-track for IM injection. You don't have to push really hard or these pads will come up, so just push a little bit, just create a little bit of distance there. I'm going to inject straight in, once again holding by the barrel, go all the way in, then I'm going to come back and do an aspiration where I'm going to pull back a little bit. I do not see any blood in the syringe, so I'm going to go ahead and inject it slowly as well. And then hold for 10 seconds. 5, 6, 7, 8, 9, 10, coming out, letting go of the Z-track, and then putting the safety. Okay, then I'm gonna hold the just slight pressure, or just kind of place the gauze over the top. And then the last thing I'm going to do is wash my hands.